Bismillahirrahmanirrahim. Assalamu alaikum everyone. Welcome to my channel. Today we are going to discuss basic anatomical terms that are used by healthcare professionals. Let's start with anatomical position. But if you have not subscribed to my channel yet, please press the subscribe button and hit the bell icon. Let's see anatomical position. In this position, the body should be upright, arms are at the sides, palms facing forward, feet are together or slightly apart, toes facing forward. Anatomical terms are like map for the body. They help us describe the locations of different parts and how they relate to each other. Let's go over some of the most important terms with examples to make it clear. These are the basic terms. Anterior or ventral, posterior or dorsal, superior or cranial, inferior or caudal, medial or lateral, proximal or distal. These are just like words opposite that we have studied in our junior classes. But in advanced form, let's see. Let's start with an anterior. It is also known as ventral. This term means towards the front of the body. Let's see it with the examples. The sternum or breastbone is located anterior to the spine. Your tibia or shin bone is anterior to your calf muscles. Your chest is anterior to your heart. Next is its opposite. Posterior, also called dorsal. It means towards the back of the body. Let's see its examples. Your shoulder blades are posterior to your ribs. Your spine is posterior to your heart. Your hamstrings are posterior to the quadriceps. Next is superior or cranial. This term means towards the head. Remember it with the cranium bone. Your head is superior to your shoulders. Your heart is superior to your stomach. Your eyes are superior to your nose. Inferior or caudal means towards the feet. Your feet are inferior to your knees. Your stomach is inferior to your lungs. Your hips are inferior to your waist. Next is medial. Medial refers to being closer to the midline of the body. For example, the nose is medial to the eyes. Sternum or breastbone is medial to the ribs. The big toe is medial to the other toes. Lateral. It means farther from the midline. The ears are lateral to the eyes. Ribs are lateral to the sternum. The little toe is lateral to the other toes. Proximal. It means closer to the point of attachment to the body. Or your axial skeleton. The point closer to the axial skeleton means head and trunk. Your elbow is proximal to your wrist. Your shoulder is proximal to your hand. Your knees are proximal to your ankle. Distal. It means farther from the point of attachment of the body. Means farther from head and trunk. Let's see examples. Your fingers are distal to your wrist. Your feet are distal to your knees. Your ankle is distal to your knee. These terms are essential for accurately describing the body and its movements. For example, if a patient has a wound on the medial side of their leg, it's on the inner part, closer to the midline of the body. Or if someone has pain on the anterior part of their shoulder, you would understand it's on the front side. Interesting fact is that these terms are used by doctors, physiotherapists, nurses, radiologists, and even fitness trainers. It's a language of healthcare professionals. It was the quick intro of anatomical terms. I hope you found this video helpful and easy to understand. If you did, make sure to like and subscribe. Hit the bell icon so you never miss a new video. Have any questions or topics you would like me to cover? Drop them in the comments below. See you next time.